Assalamu alaikum class. Today we will discuss about human immunodeficiency virus. Human immunodeficiency virus, what disease it produces, and we will discuss some of its properties. So HIV is the cause of acquired immunodeficiency syndrome that we also called as AIDS. Okay. Now let's discuss a few of its properties. HIV basically belongs to the special class of viruses known as retroviruses. Within this class, HIV is placed in the subgroups of lentiviruses. Okay, HIV infects and kills helper CD4 T lymphocytes, resulting in the loss of cell-mediated immunity and high probability that host will develop opportunistic infection. What does this mean? That HIV जो है वो immune system पे अफेक्ट करता है या इम्यून सिस्टम उसका एक टारगेट होता है. ठीक है, इम्यून सिस्टम में हमारे CD4 टी लिम्फोसाइट सेल्स होते हैं जो कि किसी भी इन्फेक्शन के अगेंस्ट फाइट करते हैं. ठीक है, तो HIV क्या करता है कि इन सेल्स पे अटैक करके पेशेंट की इम्यूनिटी को बहुत ज़्यादा डिक्रीज़ कर देता है. जब पेशेंट की इम्यूनिटी डिक्रीज़ होती है तो क्या होता है कि ना तो सिर्फ वो उस वायरस के खिलाफ लड़ रहा होता है बल्कि उसकी इम्यूनिटी उस लेवल तक चली जाती है कि उसे और बहुत सारे इन्फेक्शंस हो जाती हैं. बहुत सारी जो पैथोजेंस हैं वो उसको इन्फेक्ट कर सकते हैं. ओके, इट ब्रेक्स डाउन द बॉडीज इम्यून सिस्टम लीविंग द पेशेंट वल्नरेबल टू अ होस्ट ऑफ लाइफ थ्रेटनिंग अपॉर्चुनिस्टिक इन्फेक्शंस, न्यूरोलॉजिकल डिसऑर्डर्स और अनयूजुअल मेलिग्नेंसीज. सो जैसे कि मैं आपको पहले बता चुकी हूँ, ये बॉडी के इम्यून सिस्टम पे अफेक्ट करता है जिसकी वजह से पेशेंट को लाइफ थ्रेटनिंग अपॉर्चुनिस्टिक इन्फेक्शंस जो हैं वो हो सकती हैं और इसके अलावा कुछ मेलिग्नेंसीज भी हो सकती हैं. Now we will discuss a little bit about its structure. It has a reverse transcriptase enzyme, you can see in the center, and two single-stranded RNA are shown with the reverse transcriptase, and all other spikes are its proteins. It has a matrix protein plus it has P24 core protein. So all of these are showing its structure, means these will also affect its pathogenicity. Okay, it increases its pathogenicity. How this HIV is transmitted? It can be transmitted by sexual contact, by infected blood transfusion, means if there is a patient's blood which is already infected with HIV infection and we transfer it into a healthy person, so it can be transmitted through blood transfusion. There is also perinatal transmission, means that from mother to child, either to the placenta at birth or via breast milk. It can also be transmitted via breast milk from mother to child. How it is transmitted? By unprotected sexual intercourse with an infected partner. It can also be transmitted through vertical transmission, means from mother to child, in utero, during delivery, or during breast milk. It can also be transmitted by injection drug use. It is rare, but mostly it can be transmitted through this. Okay, as you can see that there are a lot of people out there who are using drugs with same injection. Okay, so the infected person can transmit his disease through this process of drug abuse. Okay, HIV. Now we will discuss a little bit about its pathogenesis. As I have already told you that it affects the body's immune system. So HIV infect helper T cells and kills them, resulting in the suppression of cell-mediated immunity. Okay, this predispose the host to various opportunistic infection. HIV also targets Th17 cells. These cells are important mediators of mucosal immunity, especially in GI tract. If the mucosal immunity is interrupted in the GIT, what will happen? Then there will be more bacterial pathogens will be infecting that person, means the GIT lining will get disturbed, so there will be more pathogens that will infect that person. HIV also infects brain monocyte and macrophages, producing multinucleated giant cells and significant central nervous system symptoms. Okay, what basically happen? There will be the primary infection of cells in blood fluids. Okay, CD4 cell, dendritic cell, and macrophages. Then the infection will transmit to the lymph node. When the infection is established in the lymphoid tissue, means lymph node, this is known as primary viremia. There will be acute HIV symptom, and that from there the infection will spread throughout the body. What will be the immune response? There will be anti-HIV antibodies will present in your blood. Partial control of viral application will occur. But in case of latent infection, what will happen? There will be other microbial infection will start to occur in that period. Okay, means the other pathogens will also infect that person. So, and also latent infection means an infection that is hidden, inactive, or dormant. The patient is infected, but the infection is hidden at that time. So there is that is not an active infection, that is inactive infection. But the virus or a bacteria is replicating throughout that period. Okay, in the latent infection, what will happen? Then extensive viral replication will occur and CD4 cell count will start decreasing. Destruction of lymphoid tissue and depletion of CD4 cell type. Now we will discuss a little bit about its clinical findings. There are few stages in HIV infection. There first stage is early or acute stage that begins within 2 to 4 weeks after infection, and it is characterized by flu-like syndrome. Okay, flu-like symptoms will occur in this. Patient will experience a little bit about fever, lethargy means weakness throughout his body, sore throat, very common symptom. Generalized lymphadenopathy means there will be a painful lymph nodes, or there will be infection in lymph node, and that cause swelling of the lymph node. And there will be a maculopapular rash, a light pink and red raised and flat, you can say, rashes on your trunk, arms, legs occur. There will be decreased WBCs, but the number of CD4 cell will be normal at that time. In this stage, infection is transmissible, means it can transmit from one person to another, and mostly it resolves in 2 weeks. The second stage is the middle or the latent stage. Latent stage means the infection is hidden. Okay, a long latent period usually start, and typically it lasts for 7 to 11 years. Patient is asymptomatic, means he is not showing any symptoms, and there is a large amount of HIVs produced by the lymph node cells. A syndrome called AIDS related complex can occur during this period, and it manifests as persistent fever, fatigue, and weight loss, lymphadenopathy. What will happen in HIV AIDS or late stage of the HIV infection? There will be decline in number of CD4 cells to below 200 microarray. Okay, and there will be increase in frequency and severity of opportunistic infection. That is the late stage, which is also called as AIDS. In AIDS, there will be decreased number of CD4 count cell, so the immunity of a person starts to decrease, and it become so low that there will be frequency and severity of opportunistic infection. Acute HIV will show the flu-like symptoms that occurs days to weeks after contracting HIV. In chronic HIV, also known as latent or asymptomatic HIV, can last for several years. And in AIDS, when occurs CD4 cell count fall below 200 cells, it makes a person vulnerable to opportunistic infection and AIDS defining condition. So I have also added again a slide to show you different stages of AIDS. Stage 1 is asymptomatic, no symptoms of HIV disease. There will be short stage, and there will be flu-like illness occurs between 1 to 6 weeks after the infection. Infected person can infect other people. In stage 2, there are mild symptoms, average 10 years, mild symptoms. HIV in blood drops to very low level, and antibodies are detectable in the blood. In advanced symptoms, the immune system deteriorates. Opportunistic infection will start to reappear. Whereas in severe symptoms, there will be a rapid decline in the number of CD4 cells, and opportunistic infection becomes severe and cancer may develop. So, in other picture showing what are the symptoms that really happen. There are few symptoms related to immunological symptoms. That there will be low white cells, WBC count will be decreased, CD4 cell count will be decreased less than 200 cells, and opportunistic infection will start to increase. There will be lymphadenopathy, and patient will feel fatigue all the day. What other symptoms are present? There will be poor wound healing, there will be skin nears and night sweats. Related to the respiratory system, there will be cough present at that time. GIT symptoms, there will be diarrhea, weight loss, nausea and vomiting. And central nervous system, patient will feel confusion, headache, visual changes, there will be personality changes, there could be some seizures also. And opportunistic infection means what other bacteria or fungi will affect that patient. There will be protozoal infection, there could be fungal infection like candidiasis, there could be bacterial infection, mycobacteria, tuberculosis, there could be viral infection that could be because of cytomegalovirus, herpes simplex virus, there could be some malignancies associated with AIDS, that is Kaposi sarcoma, non-Hodgkin lymphoma, or there could be AIDS dementia complex. So all these can occur in the patient of AIDS. That's why patient get infected with other disease. That's why the immunity is decreasing again, is decreasing more rapidly. Okay, so now discuss about the lab diagnosis of this. What will happen? So first of all, we will perform ELISA test, that is enzyme linked immunoassay. It detects the HIV antibodies and antigens in the blood, and antibodies are proteins produced by the immune system. We will do the Western blot, aura quick PCR, CD4 cell count, viral load assays, and test for drug resistance. Okay, thank you so much for watching.